Really, the conversation is about reherniation, and patients are always thinking about the here and now. What about my leg pain that I have right now? And I'm thinking about, what are we going to do with you long term? Let's make sure that you have a good outcome, not just now, not just in the next few weeks, but in the next few years of your life. And so the conversation really revolves around, what can we do to make sure that you have the best possible outcome for the rest of your life, not just for the next 6 to 8 weeks. There's a couple of things that make me worried about recurrence. One is really the size of the disc. In other words, the size of the disc that's remaining, that's there. If there's a lot of disc remaining behind, particularly in some younger patients, but also older patients, it just depends on your genetics. There's a lot of disc material that can push back through, then you're probably more likely to have a recurrent disc herniation. Inside the operating room, we were able to measure the size of the hole the disc came through, and we know from studies that the bigger that hole is, the more likely they are to recur. And then finally, it has something to do with just patients and their desire to get back to normal activities. I've got firefighters and police officers and people who do really important jobs, but it involves very physical activity. And unfortunately, those patients probably are more likely to have a recurrent disc herniation or try and get back to those activities that might cause their disc to reherniate. I usually tell patients that the Barricade is really a big barrier, right? It's a stop in the gap to ensure that the disc material doesn't push through. I tell patients it's a lot like having a tube of toothpaste, and unfortunately the cap has been taken off. So any significant pressure to that toothpaste, and look, all that toothpaste is going to come out. So the Barricade acts like a temporary cap we put right back on that toothpaste tube to make sure that if any pressure does exist around that tube, we don't have material just pushing back out again in and towards the nerves.